Hello and welcome back to Silvia's Health Hints. In the second video about mental health, I would like to treat depression and vitamin deficiencies. Depression is a widespread common disease. More and more people suffer from depression, and the use of antidepressant drugs is steadily increasing. There are about 350 million people affected worldwide. Worldwide, depression is the leading cause of incapacity of work, and there's no other disease with the same negative impact on patients' life like the depression. Since I started primary care, depression and its concomitant diseases has become more and more the focus of my work. Depression is a difficult disease that has multiple causes and manifestations and is therefore not always easy to recognize and to treat. Every depression and every patient is unique and needs a personalized treatment. Causes and risk factors of a depression include genetic predisposition, positive family anamnesis for depression, partner or other close person affected by depression, presence of other psychological or psychiatric pathologies, difficult life circumstances, burnout and chronic stress. Nutrient deficiency, in particular vitamin B6 deficiency, vitamin B12 deficiency and vitamin D deficiency are also a factor in depression. If there is a suspicion of a depressive disorder, a blood work should be done before therapy. It should investigate iron deficiency, ferritin, thyroid gland, blood sugar and the mentioned vitamins. The vitamin deficiencies, especially vitamin D deficiency, can be the cause of depression, aggravated or occur with other factors. International scientific studies have shown that depressed people often have a low vitamin D level. Vitamin D deficiency doubles the risk of developing depression, especially in the presence of other risk factors. This is especially true for older people, and this because older we are, less vitamin D our skin produces at sun exposure. An example which everybody will understand and knows about the connection of vitamin D and depression is the very mild form of depression, the so-called winter depression, that in the months when there's not so much sunlight, we feel a little bit down because we don't get enough sunlight and as a consequence don't produce enough vitamin D or less vitamin D. Light to medium depression may be treated successfully and permanently also without antidepressant drugs by correction of the nutritional deficiencies, in particular with vitamin D medication, regular physical activity, sufficient sleep and psychotherapeutic support. Pharmacotherapy at the beginning often is not uncomplicated. It takes some time to find out the appropriate antidepressant drug and the right dosage for the patient. In many cases, they lose their positive effects after a period, but lead to a psychological dependence. You should always first take the above measures and at the same time try to improve your lifestyle with psychological support. Okay, this was about depression with a focus of vitamin and vitamin deficiencies. I hope it was a good introduction into this subject. Thank you for watching this video. See you next week.